We won't go into that into too much detail, but we'll share with you at the end some very, very helpful resources. So how can DBE help? Who are the contact pages on DBE, the Grow contact details, and the resources and support that we have available for you. All right, so get your pen and paper ready, have your cup of coffee ready, and then Paul, I think maybe you should kick us off with an introduction to the registration drive.
Thank you so much, Aline, and good afternoon, everyone. As I've already been introduced, my name is Mpopa Pale from the Department of Basic Education. So today we are here to discuss our Bana Pele ECD registration drive. And one may ask, what is this Bana Pele? What's happening there? How is my involvement there? And in terms of support and partnership. So just to indicate that this drive we're doing together with you, colleagues, as people who are stimulating our children, so that we make sure that we are partners in this drive. So what is the Bana Pele ECD registration drive? Registration is not a new thing for us. We have been registering our ECD programs, but now we're looking in terms of improving our ECD program so that we provide quality. So we're looking at having every child in our country to access quality ECD program. And when we talk about quality, we're looking at three things: that we're looking at quality learning and development opportunities that will be provided in all our early learning program. We're also looking at an environment where we are providing the services so that it be a safe and nurturing environment so that we can stimulate our children. And in the stimulation of our children, we need to stimulate children who are well taken care of. So nutrition is one of the areas that we're looking at so that our children can be stimulated. They need to have good nutrition. So to make this possible, we need to register our ECD programs. And in order to register our ECD programs, we need to know where you are. How are you functioning? How many children do you have? How many practitioners do you have? So this year, the minister has embarked on this registration drive. So over this financial year, we'll be looking at getting all our ECD program in the system. So doing this, we'll be working closely with the provinces and also closely with you so that all children can access quality services. What is the problem that we are addressing through this mass registration? Because one might say everything is okay. Why do we need this? So we had conducted our census where we were able to identify our ECD program. And what we found out is like half of our ECD programs are currently not registered. And when we talk about registration, we're talking about registration in terms of the Children's Act. So where we have in terms of Chapter 5 and Chapter 6. So looking at the census, about 20,000 ECD program, they operate outside our regulatory net, which means they are losing in terms of oversight, in terms of support. So how do we get them in our system? And also we look that most of our children who are attending, they cannot access the support that we are providing in terms of subsidy, because subsidy is being provided to the registered ECD program. So this subsidy also helps in terms of improving quality. So if you are not registered, it means our children are missing out to benefit from the subsidy. And when you look in terms of the unregistered, most of the unregistered are in our low-income communities, which means most of our poorest children are missing out in terms of oversight, in terms of support, and in terms of funding. Hence, we are saying, let's move on, let's work together, let's register our ECD programs. So also looking in terms of the Bana Pele, that's where we're looking in terms of how do we make sure that we register our ECD program? What is the main aim? What is it that we are trying to achieve through registration process? So we want all our ECD program to function within the regulatory net. We need all of us to adhere to the norms and standard so that we are able to provide care and support for our children. So when we talk about this, we're looking at ECD program, both at center-based and non-center-based ECD program. So we're also looking at our play groups, our mobile, and also our toy libraries, and also our day mothers that they need to be registered. And also we want to improve around compliance. And when we talk about compliance, we're not working in silos as a department, we're working together with the municipalities. So we know that there are requirements that we need to adhere to in terms of the municipal systems, where we work together with our environmental health practitioners and also with other units within the municipalities. So we want to improve and support all our ECD programs so that they can comply. And also we want to make sure that our programs, they apply for subsidy. And as you know that we have received an extra allocation from National Treasury in terms of our ECD subsidy, where it has increased from 17 Rand to 24 Rand. So we want all our children to benefit from this subsidy. So you'll need to be registered so that they can benefit. And also we're looking at the administration or the process for registration. So now when we look at the Bana Pele, we want the process to be much less time and the resources that are intensive for our social officials and social service professionals. So the administration process has been simplified and you are able to access our registration system. In terms of how we'll achieve these aims, the main thing here is to improve quality, to provide support, to make sure that our children are safe, and also to make sure that all of them are put in the system. We do have a system, we need a database, we need to know where you are and what can we provide. So the difference in terms of the entry points, the new system is digitalized, it's simplified, and also the support in terms of the registration process. So you'll be looking in terms of the end-to-end registration process where continuous support will be provided. And this will be done together with our NGOs and also with our district officials who are assisting. And also we're looking at this system that it is more realistic and attainable in all our communities. So the entry system is simplified, and also I will look into the different avenues how we can assist. So also the requirements that are there, they are made clearer and the process is more straightforward to navigate. So I already mentioned that support will be provided throughout so that registration can be done. So in all the support that we are providing and how we will make sure that we register all our ECD programs through the system, that's where we have organizations that are supporting us and also the different social workers or social services professionals that are in the district level. One might ask, how is that process or how does the process look like? What is the process? So in terms of the process, it's divided according to the different stages. We have the 3 stages that we'll be going through in terms of the process. So the first stage is where the ECD program will start applying. That's where we call it the initial conditional registration. And the main aim or the main goal of this stage is to get all our ECD program in the system. As I've already indicated that it's a digital system, it's the eCares system that has been created so that we know all our ECD programs where they are. So the first stage, we call it the bronze stage. That's where we're saying, here is our ECD program, here is where we are situated, here's the number of children that we are servicing, and here is the staff that is stimulating our children in terms of checking them against the child protection register. So you'll be going also through the health and safety requirements, the minimum one that you'll be assessing to make sure that you adhere in terms of the first stage. So as soon as you have submitted the documents and also filled in the application form, then our provincial or our district social worker will review the form and also you'll be registered under conditional registration under the bronze level. That's where our ECD program will then receive the bronze level certificate. Then that's not the end. We move to the next stage. As we move to the next stage is more on compliance. So that's where we'll be looking at complying to the norms and standards. So we do have the minimum norms and standards that are allocated around the silver level that you'll need to adhere to. So also here will be supported by the department and also by the NGOs so that we comply with the minimum standards that have been identified for the silver process. So here also is an important stage where there will be site visits that will be conducted to our ECD program. So the site visit will be conducted by the social workers, the area social workers, and also they will not be doing that alone. Also, our environmental health practitioners will come through and assist and do the assessment whether you comply with regard to the health and safety norms and standards. So working together as a team, then we'll be able to assist the program. You fill in the documents that are required around the stage. And as soon as that has been done, then we'll be looking in terms of the assessment when we do the visits. Then we'll be looking whether you adhere to the norms and standards according to the silver stage. Then after having the silver stage, you'll have the certificate that will be issued, and just to indicate that when you are at the silver stage and you have the certificates, that's where you can apply for the subsidy for us to support in terms of making sure that our children access quality services. Then there are other programs that when we get to the second stage, they will automatically qualify for the gold stage, which is the complete registration or the full registration. But there will be others who will comply with the silver ones. So the ones at the silver one, they'll need to move to the next stage, which is the complete stage. That's where we're saying now your ECD program is fully registered. So at the silver, there will be other areas that needs to be improved, the other norms that you'll need to adhere to. Then you'll be supported and provided with a necessary support so that you can reach the gold status. So the gold status is where we say now you are complying with all the norms and standards and you will be fully registered. So the stage 1 and stage 2 is conditional registration, then stage 3 is full registration. So that's basically in terms of the new mass registration process, in terms of the different stages. So that's where we need and will work together and support each other so that all our programs, they are provided in safe environments for our children.
Excellent. Thank you, Mpho. That's really helpful. I just want to pause here for a second. So let's make sure if I'm understanding this. There are 3 stages. I apply, then I get my bronze certificate, and all of that happens online. That's in this new eCares system you're going to tell us a bit more about now. And then I move to the next stage, which is comply to get my silver, and finally stage 3 to get gold. And that I can apply for the subsidy once I achieve stage 2 silver. Okay. Now, I see many questions in the chat. We are going to get to them, but I think in the next slide, Mpho has got a really helpful slide next, where she explains clearly, should you be doing this eCares system or not? So in the chat, there are some people that have a certificate from 5 years ago. Some people have a certificate with DSD. Listen carefully now as Mpho explains the different tracks.
Okay, thank you so much, Lynn. And as we know that our ECD programs, we are not on the same level when it comes to registration and also when it comes to functioning of our ECD program. So there will be ECD programs that we are saying these ones are not registered and they have not yet submitted an application. So those new, the ones that have not started with the registration process, that's the one that they were saying that under track 1. Then under the unregistered also, we'll be having the one that they are unregistered, but they have already started with the process of registration, where they will be having an application that was submitted and in the process, but they have not yet been visited either by an environmental health practitioner or our social workers. Then there'll also be the unregistered ones where they have done an application, they are in the process, and also they had a visit from an EHP. So those that you're looking in terms of track 1, 2, and 3, It's a bracket of all the unregistered ECD program that are on different levels in terms of their functioning. So for the mass registration drive, the one that needs to start on the eCares system, we are focusing on the ones that are not registered and they have not submitted the application. So already this Bana Pele, we are not starting it now. We already started it last year in July. So there will be others who have started already and they have the new bronze certificate that they were able to access through the Bana Pele registration. So those who have already started the process, then they will move to the bronze level. Then there'll be the ones that are under track 2, which is the unregistered ones. They have already started the process through the Bangasali. They've already been engaged and involving and working with our officials. So what we did around this, we had a ministerial circular that was issued to our provinces to say that our social workers, they need to finalize the process and issue the certificates as soon as possible for the ones that have already started the process through the Bangasali. So they will need to finalize those ones. They don't need to start the process again in the eCares system. So the only ones that are starting there is the ones that have not yet submitted at all. Then we have other ECD programs that are registered, conditionally registered and fully registered. So we have the ones that are conditionally registered, but you find that their certificate has expired in the past year or they are expiring in the next year. We also have the ones that you say they are fully registered. Now, also these ones, you find that their certificate has expired in the past year or they are expiring in the next year. What we did also here, a ministerial circular was issued where we requested automatic extensions so that we can focus more on the unregistered. So those that have registered conditionally and fully with the registration certificates that are expiring, extension has been granted for them so that they can continue to be registered. So you'll be working together with your province or your district where they will provide automatic extension. So these ones, they need to worry because the registration will still be valid even if they got it from the, as they were doing registration with DST. So those are the ones that extension has been offered. So in terms of these tracks, an important thing to note here for Bana Pele process, we're looking at the unregistered that has not submitted the application yet. Okay. In terms of the stages, maybe I've already alluded to the 3 stages. So now I'll be looking further, providing more information in terms of the steps in the different stages, but also Lindsay will take us through the stages around the apply. But what I need to indicate here is in terms of the application, how it starts. So as already mentioned that we have a census in terms that was done to identify our ECD program. So we do have a database of the unregistered ones. And also our district and the provinces, they do have a database in terms of the unregistered. But also you'll find that there are other ECD programs that are not on the database. So they will need to contact our district offices so that they can also be recognized and assist in terms of registration. So what we will be doing is looking at all this unregistered. Then a WhatsApp message will be sent to those who are on the census database and the database that we have concluded with our district. So when you receive that message, it will also direct you in terms of information or the steps that you'll need to look into when you do the registration. So that's where you will start in terms of the online registration. There's a link that will be provided and you'll go into the link and Lindsay will explain better in terms of the different steps. So that's where our process starts. So we are saying that also during this, we want to pull all our ECD program so that they can be registered and also that you start the process and be identified and be on the database. Then after you have the link and also the information, it will take you through the process. Then you will start with your online application. The online application will also include the health and safety self-assessment that you'll need to go through, which means the program will assess yourself whether you are adhering to the minimum health and safety in terms of the bronze process. Then also here, what is important is the upload in terms of the staff that is working in an ECD programs. That's where you'll have the staff IDs and also complete the Form 30. The Form 30 is in terms of the Child Protection Register, where we will need to check the staff if they have not committed any crime against children. So all our staff members that are working in our ECD program, they need to be checked. We need to make sure that our children are being stimulated by the staff that is not appearing or those who have not committed crime. So also here to indicate that we have a call center, we have our local NGOs like the Grow ECD that are providing support so that they can take you through the process and assist you at this stage in order to upload and also to go through the application process. So where you get start, then the call center can assist and they can pick up that you have already started the program, but you are not moving forward. Then they will call you to say, how can we assist? Then after having completed the application and done all the self-assessment and uploaded the stuff, then it will move to the next step where the district officials will check the documents. So that's where they will run and review and check and look at the CPR to check if your staff is not on the child protection register. So this is a quick check that is done online and that is done by our officials in order to verify. So after doing that, all the process and making sure that you have filled everything, then the district official will issue a bronze certificate. And also to indicate here, this bronze certificate has time limit. It's valid for 1 year. So in this 1 year, you need to work together with the local NGO, with the officials that they support you so that you can move to the next stage, which is the silver registration. So there will be readiness assessments that will be done, support that will be provided to make sure that your program is ready for the next stage. So that will be done within a year period so that you are supported to move forward. And the benefits for this stage, as already indicated, this is a fully digital application. The review and the approval is done through our system, which is the eCares system. So here also there's no need for ECD collect forms or to come to offices to submit because everything is being submitted on the digital platform. And also the online application process will check that the correct information is completed, the right documents are uploaded, so there will be less movements in terms of taking you back and forth, in terms of the correction where you didn't do well and everything. All this will be done on the system and it's much quicker. So also the social workers, the supervisor, the directors can review the application and they can do that on their system or on their devices. And if there's issues that they need to address, they can send you notes that you need to correct this, you need to do this. And also in terms of doing that, support will be provided. So different roles in the system will allow for review and approval, and also in terms of generating the certificate. So after all has been done, automatically the certificate will be generated as it will be approved. So just to indicate that the application process will be simpler and quicker for both the ECD program and also for both our officials who are assisting. Thank you.
Wonderful. Thank you, Mpho. Thank you. Okay, so I think Mpho has answered some of the questions that some of you might have had on the call. But for example, Anna, like you mentioned here, you registered with DSD, but it has expired in October 2024. So then technically she does not have to reapply right now, right? Because she's already on a system, an official DBE
Yeah.
and DSD system already knows about Anna's school, so she does not have to do this. Whereas I see people saying, "Ooh, no, they're still waiting for their NPO certificate," or they're like, "No, I'm running it from home." No, you must still register, no matter where you're running your ECD center from, whether it's from a home, from a church, from a building that you're renting, you must register. And do you have to wait for an NPO registration? No.
No, you don't have to wait for the NPO registration. Remember, the registration
Yes.
that we're talking about now is registration according to the Children's Act.
Yes.
So the NPO registration is another one. And remember that there was a circular that we shared that in order to get subsidy, we don't look at the NPO registration. The
Yes.
NPO registration is where you need to raise funds for your organization in terms of raising funds that will be using that. But for our subsidy, you don't need the NPO. So for this registration, we're talking about the registration according to the Children's Act.
Yes. So if your children are in your care, then you need to register. Absolutely.
Yes.
I'm going to see if there's maybe one or two more questions. Maybe Lindsay, as you walk us through the eCare system at the end, we'll probably talk a little bit about how long does it take and when can I expect my certificate? Okay, so let's start there. Lindsay's going to walk us through the system, and then we'll cover some of those eCares specific questions that I see coming up.
Awesome. Thank you so much. Thanks, Mpho. Um, I learned some new things now again, refreshed my memory. So that was really helpful. I'm going to walk us through the 13 stages of the bronze eCares process. The screens that you will typically see are going to be on the screen here. And I'm just going to give you some tips based on our experience here at Grow around supporting ECD centers with this process. Some top tips from the team. Okay, so on this first screen, what you'll see is the place you go to sign in or to register. So if you've previously received a e-number, you'll know what I'm talking about, and an SMS from eCares, you are already a user, and then you would go to log in. But if it's your first time on eCares, you will go and you will register, right? So that's your first name, your last name, and your cell phone number, as well as your email. Now, my top tip here is please make sure the number that you put down there is the number that you can receive SMSs on, because you will receive updates and passcodes. If you've lost your password, that's the number that's going to get SMS'd. And for this initial login process, registration process, you're going to get a special number. So make sure that the number you use there is SMSable. Okay. Then, if you are already a user and you log in, you will notice that you must please remember to use, instead of saying 084 or 084, you say 2784 at the start of your cell phone number, right? So you use the country code to log in. No plus sign or anything like that, but when you are already a user and you're logging in, make sure you say 276, whatever it is. Okay.
Yes. I think that maybe was the question that Mpho had, and Faith. I see you also say you're having trouble logging in. So maybe that's your issue with your cell phone number. If you're logging back in, don't use 0 at the front, use 27.
Yes, and if you are struggling to log in, there's a reset or recover password button under the um, uh, prompts. Click on that, submit your phone number, and like I said, you'll get an SMS with new login details immediately. So the system works very efficiently. And so if that's your challenge, feel free to recover your password. You don't have to sit trying, because it will also lock you out if you input the wrong password too many times. Okay. Next slide. So one thing just before you sit down and complete this process, it is absolutely possible to do this in one sitting if you are prepared. So I would suggest going through these slides and this recording again, putting all your documents together, knowing all the particular details you need so that this is a very efficient process for you. Because you could sit down at one of our registration clinics at our computer room, people come in and in half an hour they're done because they came prepared. So it really is possible. So on the first step, you'll see prompts for the name of your ECD program and some of your general information. Sometimes it's a little bit confusing because it asks there for the name of the ECD program and then the name of the organization. So yeah, when they're asking for the name of the ECD program, that is the name of your center. And in general, the next question is also going to be the name of your center. So for example, with GROW, you wouldn't write there GROW ECD as my program. You would write your center, ABC Daycare, as your program name. Okay. And then again, later on, you will see on this page, they ask for a phone number and it is asked for in the 27 format. So not 072, it's going to be 2772. Okay. They ask for an email address, but that email address is not compulsory, although it is a very good idea for everyone to have an email address. Okay. Next slide.
Oh, sorry. There we go.
Great. So after you register yourself, you'll be asked to add in the details of all your other staff members. Okay, so yeah, the first thing to note is don't re-add yourself. When you started the process and you logged in that first page, you were included as a staff member automatically. And now this is your other additional staff. And this is everybody at your center that is engaging with children, right? It's the cook, the administrator, the gardener, everyone. Okay. You will add their name and surname, their type of identity document, their phone number, as well as their email address if they have one, and you'll identify there whether or not they've got, what kind of qualification they've got. And it might be that they have accredited ECD skills training or no qualification, or there are lots of options. So just choose the appropriate one. Okay, and you add all your staff members here. So at the bottom, you save and then you click add new and you keep adding until you're done.
Ah, okay. So I add the first one, then I add new, add new, add new. Okay.
Yes, until all your stuff are on there. Okay. Awesome. Then in terms of the next step 3, there you'll again have the name of your ECD program and the name of the organization that'll pull through. And what they're asking you on this page is to specify how many hours a day you are looking after children and how many children it is, because as you know, depending on the number of children and the number of hours, you will have a different registration type, right? So in this case, on this screen, and I saw a question about this, do I register if I'm a day mother? Yes, you absolutely do. So in this case, there are 6 or fewer children that are attending the program. It's for more than 16 hours per week, and automatically the program type will pop up for you, right? You don't have to select it. Based on the number of hours and the number of children, a program type will pop up for you. Importantly, the phrasing of that question, what is the maximum or highest number of children that you enroll at any one time? That can be a little bit confusing because people say, well, no, I only enroll, one new child starts every week or every day. And, that's how they're framing it. But in actual fact, no. What we mean here is, in general, how many children are attending your center, your capacity of your center at any one time. And so that's what you are including there. So if you're an ECD center, you're generally going to say 6 or more and for more than 16 hours per week. Right.
Lindsay, there was a question on the staff section. If staff have passports, is that also fine?
Yes, you can type in identity type. You will just click passport and then you will be able to input a passport number.
Okay, now we're going to step 4.
Okay, you go just one back.
One back.
So the last question there says, does your program receive support? If you want to indicate there that your ECD is supported by GROW ECD, for example, that's very helpful to the NPO that's supporting you because they'll get an update on the status of your application. And then they can follow up with you and say, hi, Pumza, a reminder that bronze is incomplete. Or, oh, we need to resubmit this ID document because it was too blurry or whatever it might be. So that's very helpful if you are affiliated or working with an NGO on that. Their name should pop up there and you can select them to have access to that. Great. Then we are onto the address. So as you can see, this is all information that you can have handily on hand, available and just input, right? So on the address, it's province, then municipality, then area, and then suburb, what would be helpful for you to know is your ward number, because the ward number is going to pop up at the bottom and it's going to be automatically generated based on the inputs that you've provided. And then if your ward number doesn't kind of correspond, you can go back and make changes to the city area or the suburb or village as necessary. But yeah, the ward number there will pop up. The options for you will be limited. It'll say Ward 100 or Ward 60. You have to choose from the ones given. Okay, next one. Then one thing to know when you're coming in to get registered on eCares is know what is the nearest kind of landmark building that's closest to you. So often it's a police station, or it's a hospital, or it's a primary school, something like that is a good reference point, because the social worker or the DBE official will use this as a guide to help them find your center when they come into your silver registration, right? So have this information available. So yeah, you might say, okay, I near this clinic. First it's your details, the name of the building, which is usually your center, your street number, your street name, and where it is. And then after that, it says what type of building is nearby and name it so that somebody can find you. Okay.
Step 6.
Then we are almost halfway. We're on step 6. And these are some program details. And this just asks how many days of the week you offer your program, what is the opening time and what's your closing time, and then what is the highest fee that you charge. So obviously we know that lots of people charge different fees for different age groups and different services, but the question here is the maximum fee per child. So there, if the maximum fee is for your baby class and it's 700 Rand, then you put in the 700 Rand. Okay. Cool. And then we are on to having the information about the children that are in your care. Now, importantly, you do not need to come with the name, date of birth, and Rota health booklet for every child in your center to register. You don't need all that, right? All you need is information per age group, right? The number of male children, the number of female children, the number of males or females receiving the child support grant, and the number of males or females with special needs, and the number of staff per age group. There's a lovely little spreadsheet that DBE have made available that you can print out and fill this in by hand so that you have that information with you when you come to, when you get support for registration. What's really important here is that sometimes your classes don't correspond to these age groups, right? You might at your center have a class that's 2 to 4, not 3 to 4 and 18 months to 3 years. So just make sure that you are focusing when you're doing these numbers, you are using the categories here, the children's age, not your classrooms, how you've designated them, okay? Because what you want to avoid is you want to avoid duplicating and counting learners in 2 different age groups.
Lindsay, the question here.
My other top tip here. Sorry, one quick thing. My other top tip is be very careful when you click that edit button, because if you click the edit button, it's going to ask you for information, and you can't leave unless you put in information. And so if you don't have children 0 to 18, don't click the edit button for children 0 to 18. Just skip it. Yeah, sorry.
Yeah, that's a very, very good tip. So don't go clicking on edit if you don't have children in that age group, because in the system
it's going to ask you to submit
something is weird. And if you have just recently started a center, maybe you don't have children yet, can you skip this section? Or is it better to wait until you have children and then start the eCare system?
I'm almost sure that you should only start the system or the process once you've had when there are children in your care. But Mpho, maybe I'm.
Don't you know if you have an opinion on that, Mpho?
Yes, you need to have children on the system while you start with the registration.
Excellent. Thank you. Okay, now let's look at step number 8.
Great. Oh, that's me. So yes, step number 8. So in terms of step number 8, this is your health and safety assessment. And what we found people coming in and they hadn't pre-read the health and safety assessment. And so there is an opportunity to pre-read it on the screen there. You can say click here. And a lot of NGOs and other organizations, and on GROW's website, for example, you can find the questions that are asked in the health and safety self-assessment. It's very important that this self-assessment is done by yourself before you get to stage 8 of the 12 or 13 steps, right? This is really important. So you do it before, so you are at your center walking through the questions. It's not a tick box exercise. We really want you to consider the questions before you complete them. Okay, so let's go through some of what is going to be asked of you. On the next slide,
Okay.
you can see here. So you're asked there, do children experience safety and care whilst at the facility? Are the premises inside and outside safe? Is the structure protected? No smoking is allowed. You are only able to answer confirmed, right? You can only move to the next stage if you say confirmed. So it's very important for you to feel, after doing the self-assessment, that you can come into the registration clinic and log on and confirm that for yourself and for DBE officials, that you feel that this is true for your center. Okay. If you want to go to the next slide, 10, 11, and 12, they all are also asking health and safety things. So, there's no dangerous object, there's sufficient indoor space for children to play. And so this is kind of almost getting you ready for the kinds of things that are going to be interrogated at Silver. Okay, next slide. Okay, on the slide, you'll see they'll ask do you have a gas cage for your gas cylinder? The first question is actually, do you have a gas cylinder? And then if yes, do you have a cage? So it's really also showing you the kinds of things that you need to be having at your center moving forward. Okay. Then the fun part, uploading of documents. So this is where a lot of people kind of get stuck or get frustrated, especially if you have a lot of staff members, we understand. But for each staff member, you need a certified copy of ID document, right? Or passport document, whatever it might be. And that certified copy needs to be no older than 3 months old from the time you submit it, right? So I can't now be submitting because I happen to get a certified copy in January using that. Unfortunately, it has to be no less than 3 months old. Okay. And then the second thing is the Form 30 also needs to be uploaded for each person. And the Form 30 is not something that is completed by you for your staff. It is completed by that staff member because they are saying, hi, government, yes, I'm giving permission for you to look for my details on the Child Protection Register, right? So you need to make sure that they are filling in that form and they understand what they are agreeing to. So certified ID copy and Form 30 for each staff member. You click on upload document. It'll choose you to select which document type. So then you select ID and then you upload the ID and then you'll save. Then you'll upload the next document, the Form 30, and then upload Form 30. What's really great about this system is that you can save your changes and you can come back later. So if you've gotten to this point and you realize, I don't have Mpho's ID, I've got it, but it's not certified, that's absolutely fine. You save, you close documents for now, and then you can come back and upload it tomorrow or whenever it gets sent to you. So the system really is helpful in that way, that you don't have to start from the beginning. Okay. Then the self-assessment upload photo. So this is a photograph of your ECD program. Ideally, I think there's a next slide. Yes, a picture like that shows your program with children in it, but doesn't show their faces. That's the type of picture that you would want. Or you might want to take a picture without children in it of your classroom. That's also fine. Mpho, am I right in saying that this was compulsory and then it wasn't compulsory? Is it compulsory for this picture to be added?
No.
It's not compulsory.
But yeah, you can upload the photo.
But you can, yes. And then once it's done, it's done. So if you do it now, it not have to be asked for it later. Yeah. And then after that, the happy moment where we all cheer when we submit application. And when you submit an application, you'll get an SMS and we'll say your name, your application for your center was submitted. You'll also get an e-reference number. That number is super helpful as you try to navigate the process. So keep that number saved somewhere. And then also you'll see that there's a status then when you log into eCares, there's a status. And maybe now would be a good time and Paul to go through. I see there's some questions about what the different status types mean. So application submitted is what it says, right? You submitted your bronze application. Incomplete means that you have not submitted the application. There are parts of it that still need to be completed, right? Then there's something that says review pending. What does that mean, Paul?
The one that will be appearing on the status.
Yeah, sometimes it says pending review pending, and sometimes it says, I'll find some other examples.
Okay. Remember when I was explaining in terms of the process that you have already done everything, you have submitted, you have uploaded, then the social worker or the official, they need to look at the document to review whether you have correctly completed the forms, whether all things that need to be submitted have been done, and also to do the CPR check. That's the review process. So when it says review pending, it means the person who's responsible for the review, a DBE official, they are still busy with the review.
Yes. Thank you. And then there's sometimes another one which means which when it says awaiting review, and that means that the process for reviewing hasn't started yet. I think that was the clarity that I got the other day.
Yes.
So these are those stages. What's also really helpful is that another status is corrections requested. And so somebody has reviewed your application and there are corrections that are needed. And often those corrections are like you uploaded that ID, but it wasn't certified, or or the picture is too blurry of the ID document or whatever it might be. And then the reviewer very clearly indicates the things that need to be done in order for you to move forward. And you click on it says corrections requested. You click on your application, and then you just click on the view corrections, and they'll actually tell you exactly what corrections need to be made. Okay, so that is in summary the bronze process. Yes.
So while I'm applying, my status will say incomplete. While I'm filling in and uploading all the documents, it'll say incomplete. Then I must press submit. Yes. Then it's now been application submitted. Status is now application submitted. Yes. Then I have to wait for someone to review it. They're going to review it. It's maybe pending review or awaiting review. I mustn't stress. It's in.
You must not
waiting for review. I think also I know for example some provinces started earlier, right? And KZN, for example, only started recently. So it's likely that KZN haven't been able to even do many of the reviews yet, but maybe people have started applying. So that's normal. Just leave it as application submitted and pending review. But if I'm getting a status that says corrections, what did you call it? Corrections required.
Corrections required, yeah.
Then I must view what are the corrections I need to make, and I need to update my application and resubmit. So now what happens, I'm seeing some questions from people saying, okay, they've submitted, and since they've submitted, some of the information might have changed. They might have more or less learners. They might have a new staff member or a staff member has left. Is it crucial for them to go in and edit it right away? Or can they wait till the application is reopened for them to edit? Or what must they do here?
Do you want to go, Paul?
I think in terms of the question you're asking, there will be two scenarios. You'll find that already a certificate has been issued with the information. Then there'll be changes that you need to put in. Remember, I mentioned that the registration certificate is valid for a year. It means when you start the process for the silver registration, that's where you'll need to add more information or new information because already the certificate has been issued. But there'll be other instances where you see that I didn't upload or one of my staff members or whatever, but I have not been issued a certificate yet. So also the system, it allows you to go back and look in terms of the review where you add more information. So you'll be able to edit in terms of the information that you'll need to complete.
Okay, fine. So if a staff member is resigned, you should be able to delete or edit, add new staff members, that type of thing. And Lindsay, do
Maybe
you want
one
do you
other
want
quick question that I can ask
to?
and for to give us all clarity. When you are employing foreign nationals at your center, um, do they submit a Form 30 or do they have to get police clearance from their country of origin?
Okay. Remember, the Child Protection Register is being administered by the Department of Social Development. So, as the department, we have been given access so that we can check our officials. But currently, in terms of the system, it doesn't allow us to check like using a passport number or in terms of the foreign nationals. So, what we do, we request that they do a police clearance certificate or also go to their places of origin to get clearance in terms of that. But also, if they can also be checked in the sexual offense register, because that register also allows in terms of checking with the passport. But the child protection register, currently, they are still reviewing. They want to add in terms of making sure that it also covers in terms of the foreign national. But currently, it doesn't cover. They need to go to police station for the police clearance and also to their country of origin.
Mm. Okay. And then one more question here. There's a status called approval pending. What does that mean?
Which question?
Sorry, if the status says approval pending, that also sounds to me like it's under review and it will be approved soon, or what does that mean?
Yeah, the other one that will be saying approval pending is where the review has been done.
Hmm.
And remember the process, it is as it goes forward, the person who's reviewing is not the person who's approving. So
Ah,
the one who will be reviewing will send to the manager who will do the approval.
ah,
So meaning that the one who has checked the documents and everything is already done, now it's with the next person who is the approver that needs to approve. But also to mention that in this instance, as I've mentioned, that we have a call center and also we have a turnaround time. So the call center, as they work, they are able to identify the ECD programs that have been on one stage for a long time. Then they are able to look in terms of assisting so that they can move forward. So they can talk to the reviewer, they can talk to the approver so that they can process in terms of the registration. And also, if maybe a program has already started, they are stuck on one stage for one time, for a long time, then the call center can identify those and call and say, how can we assist you to move forward?
okay. All right. I'm looking at the time and I want to make sure we also get to silver. So Lindsay, tell us about the certificate and then we can move to stage 2.
Oh, maybe Paul can tell you about the certificate.
So this is what the certificate looks like. Tell us a little bit more. What do we need to know about the certificate and how we receive it?
Okay, I think for this one, Lindsay, as you finalize, where we say the certificate will be generated. This is just an example for the Gauteng one. You'll get a certificate which has an emblem for a particular province because registration is done at provincial level. So if you are in KZN, it will have the emblem for KZN. If you are in Northwest, it will have that. And also it will indicate in terms of the registration status and also in terms of the duration for registration. So it will be signed and it will be also made accessible to an ECD program. So when we look in terms of that, we'll have the name of the ECD program. It will also have the reference, and it will also have the date when it was approved and also the date when it will expire. So just to indicate that all that, we'll have also the QR code on our certificate where you can check also the validity.
Okay.
Yes.
And the certificate, does it get emailed to me or delivered to me, or how do I receive it?
So there are different avenues depending on the functioning of the district municipality. So there will be other avenues where they will print and send via email, or they can even arrange in terms of collection of those certificates, or also supported by the NGOs in the area that they can also assist in making sure that our ECD program, they receive the certificate. So in terms of the NGOs that are supporting, it's different NGOs at different districts and different provinces. So it's not only GROW that is there, there are other organizations also that are assisting in terms of registration.
Excellent. I just want to say I really appreciate, and I see that there are so many questions, and unfortunately, it's just not possible for us to answer every question individually. We're doing our best to give the broadest information that applies to everyone, and we'll do our best afterwards also on the Facebook video where you post your questions to reply wherever we can. But we only have this limited time today, and I want to make sure we get to stage 2, which is the comply stage, where you apply for your silver or gold registration. This is hot off the press news, right? This is the just recently started. So, Mpho, tell us a little bit more about this stage for centers who have now gone through bronze and are ready for silver.
Okay. After you have received the bronze certificate, that's now we move to the next stage, which is stage 2. And as I've already indicated, is the stage where we look at compliance. So this next stage will be looking more in terms of the norms and standards to ensure that our ECD programs, they are adhering or complying to the norms and standards. So this stage is where we'll be looking at a program that will be submitting the documents that are required, and also the guidance will be provided. So also here we'll be supporting with regards to the readiness assessment, and also making sure that we prepare our ECD program so that they are ready for the silver registration and they have all the required documents. So through the support system of our call center, our NGOs, and also our officials that will be able to support our ECD program. So also we'll make sure that we take steps so that we assist and support with regard to compliance. So also in this stage is where we conduct the site visits that will be done both by the education officials and also by our environmental health practitioners. So they will be visiting and doing assessment, and that will be done on different levels where they will doing observation in terms of the center itself. They'll also be asking questions or conducting interviews with the practitioners or the principals to get more information. And the other avenue is where they will look at the documents that you have submitted and do an assessment in terms of getting more information around the ECD program. So the compliance stage, that's where we do most of the work, and also in terms of the movement and making sure that we look into the compliance. So there are documents that needs to be submitted, and the documents that needs to be submitted, they'll be submitted on different levels. There will be the one that are submitted with an application. There will be the documents that needs to be available when we conduct the site visit or the site inspection. And also there will be documents that we are saying that these ones are not compulsory, but they are useful or they are necessary for good practice in terms of running our ECD program. So it means that officials will have fewer documents to check, to process and file and consider an application. So through this checklist, it's aligned to the Children's Act. It's aligned to the requirement in the Children's Act. So all these documents, they'll need to be submitted at different levels. So you will see when you go through the process that the others are for submission and the others are for inspection and the others are for good practice. So one may ask which documents are for each area. So for submission, that's where we'll be looking at a business plan that needs to be submitted, that will also outline in terms of the overview of the program and also information with regard to the children and all the other stuff that needs to be included in the business plan. Then also we'll need an approved building plan or a hand-drawn layout of the building plan. And also proof, like if you have already applied but you have not received the building plan, then you can submit that. Then we'll also need an emergency plan and also the constitution. So also here we'll need to look at this, will also include the daily program, the implementation plan, the staff composition, and the discipline policy, which will be included in the business plan. So these ones are the ones for submission. Then for inspection, when we come and visit and do on-site, we'll need to have the attendance register, the accident and the incident registers that you use, the children admission forms that will indicate in terms of the particulars of a child and also indicate some of the conditions that are there, the health and hygiene policy, and also in terms of the proof of staff qualifications. So as I've already mentioned that the norms are categorized according to the different levels. So there will be the ones that will need under silver and the ones that we need under gold. But for gold, we'll need the proof of staff qualification. Then for good practice, we'll be looking at the daily menu. We'll be looking at your nutrition guidelines, the policies when it comes to transport, the lease agreement if you have them, and also in terms of the financial statements that are there. So just to indicate that when it comes to the environmental health report, for the silver registration, we will require an inspection report that will be provided by the EHP. But for the silver one, we'll require a health certificate that will be issued by our environmental health practitioners, and to indicate that we're having sessions with our municipalities to make sure that our EHPs are assisting and working with our social workers as a team when they conduct those on-site visits. So that's
Thank you.
in terms of the
That is so helpful.
silver.
I hope people are taking a screenshot of this one. So there's such a good and interesting question here from one or two people about forms. So centers who use online admission forms or do their attendance registers and their financial record keeping online. I can't imagine that that's a problem. It's more that you should be able to provide the proof, right? And show that you're doing that record keeping, that you do have an admission form, that the admission form asks for medical conditions and allergies, the POPI requirements, that you take daily attendance registers and you can produce those results, right? I mean, here DBE is showing us the way to digital. It's encouraging us to use digital through eCares. So I'm sure DBE will be comfortable with your center as well if you're using technology, as long as you can provide and prove that. Okay, so that was very, very interesting and helpful. And if you're stressing about these forms, don't worry. I'm going to show you some resources soon. So, Paul, now we're on silver. Take me all the way to gold, please.
Okay, this is the last stage there where you need to see our ECD programs that are fully compliant with all the norms and standard. So as soon as you get the silver certificate, then you'll be guided through the next step, which is the complete step, where you'll need to submit documents and also in terms of processing the full application. So that's where we're saying that now our ECD program is complying to all the requirements. And also we're looking at complying to the minimum standards that are on the silver and also the ones that are on the gold status. So we're looking in terms of all of them that they are able to comply. So this is where we call it full registration. So in order to get there, means the program will be supported and also taken through in terms of improvement and providing the necessary support when it comes to the areas that they need to look into. So you'll find that some of the ECD program, they'll move from bronze and automatically they'll go to gold because they'll be adhering to the norms and standards that are on the gold status. But there'll be others that will be on the silver. They need to move to the next stage. So all these processes will be guided through the eCares system. So as soon as you move to the next process, like when you get a bronze certificate, then you'll get a message that, well done, now we can start, we can move forward and start with a silver registration. Then when you have the silver, then it will say, well done, then now we can start to move to the completion where you have full registration. So those are the steps that we are looking into. Then you have completed the registration process. So this is just okay.
No, please go for it.
A summary in terms of the roles and responsibilities. So here we're looking at the ECD program, the ECD center, or the program, the responsibilities that you have. And also here, as I mentioned, that we're not working alone, we're working with the NGOs, we're also working with the ECD forums. So there should be clear roles and responsibilities for each. And for you colleagues today, our practitioners, our principals, in terms of the program, you are responsible to submit the online application and also in terms of submitting all the documents. And the documents I'm talking at different levels, which is the bronze, silver, and the gold. So also you are responsible in terms of completing the health and safety self-assessment. So Lindsay has mentioned in terms of the health and safety where you need to complete. So you are responsible as an early learning program or as a center that you need to complete that. Then it comes to taking steps to ensure that you comply, because you find that now you need to improve and develop in terms of the other areas. So you are responsible in taking steps to ensure that you comply, as much as we'll be providing support and taking you through the process, but also it is the responsibility of the ECD program to make sure that you also take steps to make sure that you comply. And the other responsibility, you need to familiarize and make progress with the municipal requirements, because we'll be working with the different units in the municipality that will be taking you through. So you need to make progress and familiarize yourself with all the requirements. The NGOs that are supporting, they also have the responsibility. We're working together with them to make sure that they support and they assist, and also make sure that they run the submission clinics where they will be calling you to come in and be assisted in terms of the registration. But also to note that registration is for free. Even if we have that support and assistance, it's done for free. You don't have to pay for your program to be registered.
Yes, if someone tells you, pay me 6,000 Rand, I'll get your center registered, then you should know that is a big red flag, because registration is for free. So now we're heading towards the final section where we'll share a little bit more resources. You can also take some screenshots. Mpho, if you're happy, I'll walk through these. You can stop me if at any point if there's anything I'm missing. But take a screenshot of this page and we'll also share the details. So here is the link for the eCares system and the user registration page. There's also a fantastic DBE info page on the government's website. You can find it at this link, and I've posted that in the chat as well. And then the email address you can use is banapele@dbe.gov.za. And you can also talk to the WhatsApp line. There's a WhatsApp bot that can provide some feedback. The call center is not a call center that you can call. They will call you when they see that you're struggling and need support. But use the email address and that WhatsApp line. And on this info page that the government's prepared for us, you can even download those spreadsheets that Lindsay was talking about and those other documents. So I really recommend read through that in detail. The other thing that I can really recommend is Lindsay's point about don't just go on there and I'll create a profile and start. No, go slow to go fast. Sit down with the list of everything that you need. Sit with your cup of tea, prepare all your documents, prepare your list of learners, prepare your staff documents, read through the health and safety requirements. Then, when you sit online and you do this, you will be prepared and it will go fast. Otherwise, you will feel like it's taking forever and you're going to get frustrated. Okay. Grow ECD can also provide some support. So while we can't help every single center to get registered, by hosting this webinar, we're really hoping we're helping to clarify and explain a lot. Here are some tools that we have. So for example, later with Silver, and Paul was mentioning that you need attendance registers, you need financial management and statements. If you're using the free Grow Giraffe apps, it's already built in there and you are already sorted. Then we have some great explanatory blogs and this webinar as well. And we've shared the link to that. You can also email us to ask, and you can read through that article slowly. You can download the Form 30. You can download the spreadsheets. That blog article is very, very helpful. Next, don't go Googling business plan for ECD on ChatGPT. I know you do that. That's not what you need. Grow has already got amazing resources for you, templates that you can use to do things like your business plan or your emergency plan. We have templates available for you that you can get on our resource center. In fact, I think I should show you what that resource center looks like because you don't believe me. It really is fantastic. Let me do this to show you. On our resource center, it's resources.growecd.org.za. When you log in here, you just need your name and your telephone number, and you tell us you're a center owner, right? You can come to the different categories where you want to download resources. Here's one for registering your center. And in here, you will find the template for a constitution, HIV/AIDS policies, disability policies, daily menus, registers, committee details, emergency numbers, discipline policies, transport policies. You can start to recognize all the things that you need for registration in terms of your documents, policies, and procedures. Some of the standard templates are already available here, and you can personalize that for your ECD center, right? Because you might have unique requirements. So please do that. And then if I come back to my slides here, see, now I've messed up my slides, but that's not a problem. We also host an ECD business accelerator. So if you are located within about 70 kilometers from our office, you're close to our offices in Midrand, in Gqeberha, in Cape Town, and in Durban, we invite you to sign up for our ECD accelerator, which is a 6-part in-person training course. And on the one day, we focus specifically on registration, right? And we take you through that step by step. We support you. And not just bronze, but we also look at the silver requirements. So I think that that's very, very useful. And that costs only 600 Rand. But it fills up very, very fast. So if you're interested in the accelerator, please sign up for that soonest. And then what else? Our registration clinics. So we do our best to host registration clinics whenever we can, also based on our capacity. But we would share that in our WhatsApp groups and those types of things. So let me just check where I am now. So if you currently have the Grow ECD app, see, now I'm sharing the wrong slide. I've got myself confused here. There we go. These are more examples of the registration resources. So the first screenshot you see there is an example of what your hand-drawn plans should look like with tips of how to prepare your hand-drawn plan. That second document is a one-pager that walks through the steps of bronze registration, and it has links to the supporting documents. That's a very, very good document. The third document there is a guidebook to the silver registration norms and standards. So let's say, for example, people had questions about this type of structures that would get registered. If you read through that, it'll show you exactly what the norms and standards are for each of the aspects and what to expect people to, when they're coming for the site visit, what will they look at? So this is like having the memorandum for the exam. I know that I like to have that in advance, so you can read through that and be prepared. Let me see here. What else can we do to support you? Okay, so the Grow ECD app does have a lot of resources and support. Plus, if you sign up for the Grow ECD app, you can ask to join our WhatsApp group. So reach out to the Grow app help desk if you're not on one of the Grow ECD Giraffe app WhatsApp groups yet. We can add you there. And whenever we receive new information or updates or helpful resources from DBE, we always share it with our community on WhatsApp and on email. And then finally, yes, Lindsay, did you have a question?
No, when you're done, I think I just have one or two questions before
Good.
while we have it here.
Yes. I just want to walk through the contact details so that I know people have it. And these are the contact details for our regional offices. When you call them, no, they probably won't be able to come over to your center and register you. It's each of us, as the more than 40,000 ECD centers in the country, it's each of us' responsibility to get registered. But we have a lot of information and support available. So reach out to us regarding how we can help you with registration and beyond, because we also work in improving quality of education and building that business mindset. Okay, so those were the main things I wanted to share. Lindsay, go ahead.
Yeah, I think there's some fabulous questions, and I think we'll try as a team to go through some of them and respond in a different format. But one of the questions that came up was, what is the motivation for moving from bronze to silver? Why should a center want to move from bronze to silver, Paul? Why?
Okay, in terms of the movement, remember that our main goal is to provide quality ECD program. And for us to provide quality ECD program and also safe environment for stimulation of our children, we need to fully register our ECD program. So moving from bronze, that's where you will start in terms of the compliance, because bronze is only the first step and it includes just a few in terms of the basic or the minimum health and safety self-assessment that is done. And oh, okay, I thought I was not unmuted.
No,
Okay.
we hear you. We hear you.
And all right. And that's where we also have the screening that is done. So moving to the silver, it's where you move now to compliance with regard to the norms and standard, and where you also get a visit that will be conducted to make sure that we support you and we work together to comply to the norms and standard. So moving to the next level will also be also looking in terms of the compliance and also fully complying to be on the gold status, which is the full registration. So it's very important, because you also noted that the bronze level, it's for a limited time, where we're saying the certificate is valid for a year. So in that year's time, there has to be means to make sure that you are moving to the next step through the support and also through the ECD program. You have a responsibility to make sure that the areas that were identified for you to improve, you'll need to improve around those areas. So if you stay in one stage, when the time comes, you have not done anything, even the support was provided, and you have not done anything, then it's where you will run a risk of an ECD program that it will be issued with a failure in terms of compliance. Then you will lose the registration. So it's very important that we work together and we register and we adhere. And just to indicate that this is a legal requirement in terms of registration. All the ECD programs, they need to register according to the Children's Act.
Yep.
Thanks, Paul. And I think one last question, and it's just around, if your ECD center is located in a school, do you register that ECD center separately if your school is registered? And if you are an ECD center and you offer grade R, do you register that grade R class separately? So if you could answer those, Paul.
Yes, you do, Lindsay, you're right. If you have a grade R, it needs to be registered, but also the program that is on a school basis, it needs to be registered. Remember, our ECD program, we're using the National Curriculum Framework that we are stimulating our children. And when you move to the school, that's where they use the CAPS. So it's different programs. So they need to be registered. So also our ECD program at a school, they also need to be registered. So you'll need to reach out to our district officials to assist in terms of the registration.
Yes.
Thank you so much for that clarity.
Okay, awesome. Yes, let me look at my questions. I also had questions here about grade R, and I think you've answered that. Is there any help that we can provide people if they've since lost their phone or their cell phone number has changed? What do we do if we registered on eCares and that cell phone number is just not the one we're using anymore?
Remember, I said we can also, as you have provided the numbers that we can use to WhatsApp and also to request assistance in terms of the change of the cell phone numbers, because you'll find that most of our programs, they are stuck because they are no longer receiving messages and they are not assisted further. But also to indicate that we have the USSD where they can send that's this to log into that, which is a star 134 star 7776 hash. So if you go through that USSD, then you are able to be assisted. So it's important for them to reach out to us in the different avenues that we have indicated, the email, the WhatsApp, and also the USSD, where they will just um, dial in terms of the star 134 star 7776 hash. Then we'll be able to assist.
Excellent. Okay, I'm going to ask one final question, and I'm going to bring it back to what Mpho was mentioning from the start, which is access to quality early learning, and that every child in South Africa deserves access to quality early learning, and that often that comes down often to our curriculum and our program and our teachers and the education we're providing. So there were one or two questions in the chat about should I register if I'm providing Montessori? Should I register if I'm providing this? Mpho, let's just talk very briefly about the type of program, the curriculum and program that I'm offering, and whether everybody should register regardless or whether it's for certain ones. Mpho, so sorry, there we go.
Okay, the registration is for everyone. Remember, I mentioned that we're looking at the different modalities when we provide ECD program. So there will be a provision where you provide as an ECD center. Then that's a center-based ECD program. So there we're looking at where you are providing services to 6 or more children that you are now as a center. Then we have the non-center based ECD program. So when we talk about the non-center based ECD program, that's where we're looking at other modalities in providing services. There'll be the others that will be done through our day mothers. There'll be others that will be done through our mobile, the others that will be done through our play groups and also through our toy libraries. So in those programs, we're looking in terms of it being provided, they also need to be registered. So as long as you're providing an ECD for children looking at the birth to 5 years, you need to 4 years, you'll need to register the program according to the Children's Act.
Yes.
So those different modalities, they give you in terms of the sense of where your program is.
And that also includes aftercare. Yes. Okay. All right, everyone. We're still going.
Aftercare program. Yeah.
Tell us about aftercare.
Can I go ahead? Okay. Remember, we have partial care programs that is more than in ECD. We do have other types of partial care. So the function that moved to DBE, it's only one part, which is ECD. So we do have the after school care program. Then we have the respite care, and the other one. So those are still with the Department of Social Development. So in terms of that, because sometimes you find that the after school, it also caters for older children that will be assisted with homework and all that. So they need to be registered according to the Children's Act, and that is done by the Department of Social Development. So for us, the main focus is on early childhood development.
Excellent. All right. Now let's wrap up. I'd love to hear your final thoughts. And in fact, I think I have my final thought is maybe the same thought that Sibongile has just commented here in the post. She says, my plea is that we get every facility to register. Let's do away with so many unregistered facilities that pose a danger to our children. And Sibongile, I love what you were saying there. This is a plea. This is for everyone. So get registered. And Paul, I'd love to hear your final thoughts and yours, Lindsay, and then we'll wrap up.
Okay, I think for mine, the final thoughts is in terms of this session that the ECD programs that were able to join in. And just to say that our door are open. If you have anything that you need to be clarified on, you can reach out to us in the different platforms, through our website, our Bana Pele email, and also in terms of the other avenues for registration. So also our district officials are available. You can go to your nearest Department of Education and require assistance. So we're saying this, let's work together as partners so that we are able to support each other and make sure that we adhere and our children are benefiting and we're providing quality ECD program. Thank you so much.
Thanks, Paul. I'll just say that it's so wonderful to co-host a webinar with you. And I think this is just an example of how, especially with this registration drive, DBE and the NPO sector have really been working closely together. We have bi-weekly meetings. We've really been trying to do our best for our ECD programs and obviously for the children in their care. So yeah, this is just another demonstration of the real intention to work together moving forward. And there are a host, as Paul was mentioning, a host of other NGOs, NPOs that are also doing amazing work on this. So find your local NPO partner to help you because we are all keen to get all centers registered.
Wonderful. Thank you very much, everyone. We'll see you again at the next webinar and we'll keep sharing some helpful information. Have a fantastic day. Goodbye.